So good day everyone. So now I would like to introduce myself first. So my name is Fernalyn Cabanto. So now I will discuss today is about deep and hard of hearing learners. So what is deep and hard of hearing learners? So means is face unique challenges in education due to hearing loss, impacting language and literacy development. But with appropriate support and strategies, they can succeed academically. So now there are three types of deaf and hard of hearing learners. So first is assistive listening devices. Assistive listening devices are personal amplifiers designed to enhance sound levels during in-person talks and small group conversation para katong mga student nga naidiferensya sa ilahang pagdungog is dali sila maka sabot kung unsa to ang istorya. No dapat nga atong ikusgon ang atohang kining ah, amplifier devices. So ang ikaduha is deafness. Deafness means is a severe hearing impairment that affects linguistic information processing, while hard of hearing learners have a residual hearing sufficient for successful processing. So for example, ang imuhang dalunggan is naay ka ng na-infection mo nang kining dugay ka makadungog no sa isa ka music or kaning imuhang ka istorya or na-injury ang imuhang sa sulod sa dalunggan. Then number 3 is hearing impairment. Hearing impairment is an impairment in hearing, whether a permanent or fluctuating that adversely affects a child educational performance but that is not included under the definition of deafness. So for example is difficulty understanding speech. This can manifest as trouble hearing or understanding what people are saying, particularly in noisy places or when multiple people are talking. So, asking people to repeat themselves, this is a common sign that someone is having difficulty hearing. And in definition is the deaf community is a group of deaf and hard of hearing individuals who share a common language, experiences, and values. They use term deaf for those with hearing aids or a conquer implants, but the term deaf learners is more inclusive. Hearing impairment is a term used to describe hearing impairments that negatively affect a child's educational performance. So the deaf community embraces deaf culture through socialize and understanding that deafness is an identity with rich history, tradition, and language. They prefer terms like teacher of the deaf, school for the deaf, and deaf person, which thus not follow a first person policy.
Good day everyone. My name is Jayana Takador and I will be continuing the discussion about types of hearing loss. Number 1 is conductive hearing impairment, a disruption in the transmission of sound to the inner ear or middle outer ear problems. So here are some causes of conductive hearing impairment. The airwax buildup. Excessive airwax can block sounds from entering the ear. Airwax or kung sa Bisaya pa is buog sa dalunggan. Mao ni siya ang pangunahin nga mag-block sa sound padulong sa dalunggan pag dili na to siya mahinluan. Example scenario ani is when a child with recurrent ear infections Repeated ear infections can damage the eardrum or cause blockage of Eustachian tube, leading to conductive hearing impairment. Eustachian tube is agianan sa hangin gikan sa dalunggan paingon sa tutunlan or air passage from the ear to the throat. This emphasizes the role of the tube in air pressure equalization. Number 2 is the sensory neural hearing impairment. Problems within the inner ear or its connection to the brain. Ang atong inner ear is nag-contain og tiny hair cells na responsible for converting sounds wave into electric signals. Kini nga signal is mauni ang mag-send dito sa brain by the auditory nerve. Ang auditory nerve is a bundle of nerve fibers that carries the electrical signals from the inner ear to the brain, and if the hair cells or the auditory nerve kay ma-damage, di na siya makatransmit og electrical signal, and that can lead into hearing loss. Example scenario of sensory neural is exposure to loud noises such as construction sites. If inyong balay is tuol og mga nagtrabaho sa constructions, kay saba siya kaayo na saba ra ba kay na mag-welding, mga dagko nga truck ug uban pa, and kanang even listening to music at high volumes, especially kanang hilig mag airpods and headphones tas kusog kaayo ang volume, it can damage the hair cells into inner ear. Number 3 is mixed hearing impairment. Is a combination of conductive hearing loss and sensory neural hearing loss. This means that there is a problem with both the outer middle ear and the inner ear auditory nerves, leading to a more complex hearing loss. Example is when a person with a history of ear infections and loud noise exposure, they might have fluid build up in the middle ear from the past infections and damage to the ear from loud music. There are some treatment in this condition like removing airwax, or di kaya naa sila gina-prescribe na hearing aids o na siya ka amplify sound to compensate for both types of hearing. Hearing loss can also be classified as unilateral, bilateral, congenital, and acquired. Unilateral is affecting one ear, isa ra ka nalunggan ng apektado. Bilateral is affecting both ears. Congenital is present at birth, and acquired is developing after birth. Cause of hearing loss is congenital or daan na pagpanganak niya, and acquired. Causes of congenital hearing loss. Number 1 is genetics. A significant role often involving recessive genes from both parents, or autosomal recessive hearing loss, or a dominant gene from one parent, autosomal active hearing loss. Genetics is nana sa inyong genes na mananimo sa imong ginikanan ang kaning hearing loss. Next other factors is maternal rubella infection. Maternal rubella is kanang also known as German measles. During pregnancy, prematurity, or early delivery can cause hearing loss. Now let's proceed to the causes of acquired hearing loss. Otitis media is an inflammation or infection of middle ear, the ear-filled space behind the eardrum. It's a common childhood illness, especially sa mga nag-underage of 3. The causes of otitis media is usually occurs when fluids back up in the middle ear, often due to blockage of the Eustachian tube, This can happen because of a cold, allergies, or other factors that cause inflammation of the lining of the Eustachian tube. The fluid can become infected by bacteria or viruses. Otitis media na siya mga symptoms like ear pain, feeling of fullness in the ear, drainage from the ear, fever, irritability, difficulty of hearing, and loss of balance. There are some treatments sa mga otitis media like antibiotics. If infection is caused by bacteria, antibiotics are usually prescribed, and also pain relievers. Otitis media is further broken down into acute otitis. Acute otitis is more general term for an infection or inflammation of the middle ear. It is often used interchangeably with acute otitis or AOM, which is more specific and commonly used term. Acute otitis media is a sudden infection of middle ear, the air-filled space behind the eardrum. It is a common childhood illness, especially in children under the age of 3. The middle ear becomes inflamed and infected, usually due to a blockage of the Eustachian tube, which connects the middle ear to the back of the throat. This blockage can trap fluid in the middle ear, which can become infected with bacteria or viruses. The symptoms is same siya sa kaning otitis media. It is because sakop pa ni siya sa kanang kuan, usara ni siya ka variety sa otitis media, kaning acute otitis. The treatment is antibiotics if the infection is bacterial, pain relievers, ear drops to reduce inflammation and pain, and fluid drainage if necessary. The prevention of acute otitis media includes vaccinations, frequent hand washing, breastfeeding, and smoke-free environment. Next is the otitis media with infusion, also known as serious otitis media or secretory otitis media or SOM, is a condition where fluid builds up in the middle ear space but there is no sign of an active infection. This fluid can accumulate after a cold, sore throat, or upper respiratory infections. The causes of otitis media effusion is immature Eustachian tube. Common siya sa mga young children. The tube is shorter and more horizontal, making it easier for fluid to get trapped. Next is colds or allergies. Swelling and congestion from this condition can block the Eustachian tube, and structural defects. The otitis media effusion is more common in children than adults. It's often a temporary condition that resolves on its own. If this condition persists, it can cause hearing loss, which may affect speech development sa mga children, and also early diagnosis and treatment can help prevent complication. Next is the chronic suppurative otitis or CSO. Is a persistent infection of the middle ear that lasts for more than 2 to 6 weeks and involves a perforated eardrum. This condition is characterized by growing ear discharge and can lead to significant hearing loss, complications, and even death if left untreated. So, delikado ni siya nga case. The causes of CSO is usually develops as a complication of untreated or recurrent acute otitis, where the eardrum perforates It can also occur after ear surgery, trauma, or in individuals with weakened immune systems. The symptoms of this is the common symptoms of this is persistent ear discharge, which can vary in color, consistency, and odor. Other symptoms include hearing loss, pain, a feeling of fullness in the ear, and dizziness. Hearing loss measurement. The intensity of sound and consequently the severity of hearing loss is measured in decibels. Decibels are logarithmic unit, meaning that a small change in decibels represent the large change in sound's intensity. Decibels is representing sound intensity or energy per area. A 0 decibels is the softest audible sound, while 120 decibel is the threshold of pain. Hearing loss is often categorized based on the average hearing threshold in decibel across several frequencies. Normal hearing, typically a hearing threshold of 0.25 decibels across most frequencies. Mild hearing loss is 25 to 40 decibels. Moderate hearing loss is 40 to 45 decibels, while moderately severe hearing loss is 55 to 70 decibels. Severe hearing loss is 70 to 95 decibels, and profound hearing loss is 91 decibels or greater.
Everyone, I am Yurika Birago, BSc English 1A. So my topic is about pure tone audiometry. So when we say pure tone audiometry is a method used to assess an individual's hearing ability by measuring the response to specific pure tones. It helps determine the type and severity of hearing loss. The three main methods are manual audiometry, automatic audiometry, and computerized audiometry. An audiometer generates tone at different frequencies and intensities. The test is conducted using air or bone conduction, where the individual responds by pressing a button when they hear a sound. A hearing threshold is established when the sound is detected at least 50% of the time, and the results are plotted on an audiogram. So when we say manual audiometry is a hearing test where a trained professional controls the sound level and frequencies, asking the patient to respond when they hear a tone, helping understand their meaning threshold. So the next one is automatic audiometry. It's the hearing test where the sound levels automatically increase and decrease, and the patient controls a button to indicate when they hear a tone, helping determine their hearing threshold. And then the last one is computerized audiometry, a hearing test controlled by a computer, which automatically adjusts sound levels based on the patient's response to determine their hearing threshold. So the next one is speech audiometry. It's a general term to describe a collection of audiometric tests using speech as a stimulus. Speech audiometry can be conducted by exposing the individual to speech in both quiet conditions and in the presence of noise, such as speech bubble or speech noise. Audiologists employ speech audiometry to assess an individual's ability to perceive and comprehend spoken language. So when we say speech audiometry is a hearing test that evaluates how well a person can recognize and understand speech in different listening environments. It helps audiologists assess speech perception by presenting spoken words or sentences in quiet and noisy conditions. So the next one is speech reception threshold or SRT. refers to the decibel level at which an individual is able to comprehend speech. An approach to quantify the SRT involves administering a series of syllables to the individuals. Evaluating each air independently, audiologists commonly utilize the decibel threshold at which an individual comprehends 50% of words as an approximation of the SRT. So SRD is a minimum volume level at which a person can understand spoken words. Audiologists measure SRT by testing each air separately with two-syllable words and determining the lowest decibel level at which the person understands 50% of them. So let's proceed to alternative audiometry techniques. So the first one is play audiometry. During play audiometry, the child is instructed to engage in straightforward and specific tasks, such as retrieving a toy or placing a ball in a cup, whether she detects the signal, which can be either pure tones or speech. So when we say play audiometry is a hearing test for children where they respond to sound by performing simple tasks like placing a toy in a cup. This method helps audiologists assess a child's hearing in an engaging and interactive way. So the second is operant conditioning audiometry. In this assessment method, the child is rewarded with a token or a candy for pressing a button when a light and sound are presented together. So operant conditioning audiometry is a hearing test where a child learns to press a button in response to a sound and light cue. The child receives a reward like a token or candy to reinforce correct response. So the last one is behavior observation audiometry, a non-invasive assessment technique that involves observing the child's response to noises. An auditory stimulus is gradually intensified until a consistent reaction, such as the movement of the head, blinking of the eye, or stopping of play, is consistently seen. So behavior observation audiometry is a hearing test that evaluates a child's reaction to sound by observing natural response like head movement or eye blinking. The sound level is gradually increased until a consistent reaction is observed, helping assess the child's hearing ability. So let's proceed to characteristics. The characteristics of learning with hearing impairment vary widely depending on the case of their hearing loss. There are those learners who find amplification of sounds useful for their residual hearing, while some prefer the use of visuals and sign language when communicating. However, here are some of the characteristics that are common among those with hearing impairment. So the first is may have difficulty with speech, reading, and writing due to the close relationship of speech and hearing. Second is fail or may take time to respond quickly with spoken or verbal instruction. So the next one is may use hearing aids and or amplification system to enhance oral communication. Next is may prefer to use visuals or American or Filipino Sign Language as their mode of communication. The next one is their perspective language may vary based on their experience and development. Next is have a large deficit in terms of academic abilities, especially reading and language skills. So when we say deficit is a lack or impairment in an ability to function capacity. So the last one is in terms of social skills, deaf learners find it hard to find someone who can make conversation with sometimes lead to isolation. So I think that's all about my topic. Thank you.
Good day everyone, especially to you ma'am. My name is Lilian Maesog. So my topic is all about educational approach. So what is educational approach? An educational approach for students with hearing impairment aims to create a learning environment that effectively addresses their unique needs. This means adapting teaching methods and materials to ensure these students can access information and participate fully in the classroom. Technology and support. Some learners with HI, especially those who are hard of hearing, use assistive technology or HAT to support their audition and be able to understand the information that they get from the current settings. Sa technology and support naman, the use of hearing assistive technology or HAT for learners with hearing impairment or HI, mauni siya ang mga mag-aaral na may kapansanan pagkandinig. Binibigyan din ito the importance of teacher being aware of and providing access sa iba't ibang HAT para suportahan ang mga students to understand and enhance learning. Hearing aid. The most common type of HAT hearing aid, an airworm behind ear electronic gadget of compact size. It amplifies certain sounds to enhance listening experience, communication, and active engagement of individuals with hearing impairments. The most common type of hearing assistive technology or HAT, ito ay isang compact electronic device na nagpapalakas ng tunog upang ma-improve ang pakikinig for people with hearing impairments. The example ani is the microphone, the amplifier, and the speaker. Para mas masabtan sa mga taong may kapansanan sa pandinig, magamit sila o hearing aid. Cochlear implants. A complex of technological device that enhances hearing for people with profound hearing impairment caused by inner ear damage. The available alternative to hearing aids for those with significant hearing loss. Transmits auditory impulses directly to the hearing nerve by using a sound processors and electrodes placed in the cochlea. Sa cochlear implants naman, complex devices that bypasses damaged parts of the inner ear to directly stimulate the auditory nerve, improving hearing for those with profound hearing loss who don't benefit from hearing aid. Assistive listening devices. Assistive listening devices, or ALDS, these are personal amplifiers designed to enhance sound level during conversation. They are described as small boxes with a microphone and a listening wire. Sa assistive listening devices naman, they boost ang antas ng tunog para sa mga usapan or one-on-one small group conversation gamit ang microphone, listening wire, shared by both the speaker and the listener. Argumentative and alternative communication. Argumentative and alternative communication, or AAC, devices. These devices offers alternative communication methods for those unable to use spoken language due to hearing loss or speech problems. They are often in the form of tablets and laptops. So, sa argumentative and alternative communication naman, madalas ang paggamit ng mga tablet or laptop ay tumutulong to those unable to use spoken language o hindi makakapagsalita. Often resembling tablets or laptop, these devices also called speech-generating devices. Alerting devices. Alerting devices, these provide visual or tactile cues, flashing lights, five versions to enhance safety and awareness for those with hearing impairments. Ang significant sounds occur sa alerting devices naman ay gumagamit ng mga visual signals or flashing lights to increase safety and awareness para sa mga taong may kapansanan sa pandinig. They are also known as signalers or notification devices. Speech-to-text translation. Speech-to-text translation, the text explains how computer software or applications using speech-to-text translation can help hearing impaired learners access class discussion. Sa speech-to-text translation naman, ano siyang mga assistive technology that convert spoken words into written text para mas mapabuti ang kanilang pag-unawa sa mga discussion. Audio-video transcription. The transcription of primarily convert verbal input into text for better comprehension and visualization to text further notes that today's technology such as the television provides access to multimedia content and information and makes it easier to have captions on screens. Sa audio-video transcription is the assistive technology devices providing access to multimedia content that might be hard to understand. Modern technology like the television with captions make this access easier.
Good day everyone, my name is Cherime L. Berandal and today I am going to discuss teaching approaches. These teaching approaches for deaf education focus on different strategies to support language acquisition and communication skills. Oral or oral approach. This oral approach to deaf education focuses on developing receptive and expressive language skills using auditory and hearing aids, requiring a combination of auditory, visual, and tactile models. This method emphasizes the use of hearing aids and auditory techniques to develop both receptive or listening and expressive or speaking language skills. It relies on a combination of auditory, visual, and tactile cues to help students process and understand language. The goal is for deaf students to develop speech and listening abilities, often with the help of speech therapy and assistive devices. Total communication or TC, or simultaneous communication. Total communication is an educational philosophy and method used to teach English language to students with hearing impairments, incorporating spoken words and manual communication by Hawkins and Bronner 1997. Total communication employs various techniques to improve language acquisition in deaf children, tailoring their learning process to suit their unique needs. National Deaf Children's Society of 2024. So, total communication or TC is a flexible approach that integrates spoken language with manual communication, such as sign language, finger spelling, and facial expression. By using multiple communication methods, TC aims to provide deaf students with comprehensive language access, allowing them to choose the most effective means of communication for their learning needs. Bicultural or bilingual approach. This bicultural bilingual approach consists of three key elements: American Sign Language or ASL as the principal language, significant involvement of hearing impaired individuals, and education on deaf culture. It can be organized by learning ASL and English simultaneously by Skirmer 2001. So this approach treats American Sign Language or ASL as the primary language of instruction, with English taught as a second language. It not only focuses on linguistic development but also incorporates deaf culture, promoting a sense of identity and community among deaf students. This method ensures that students receive instruction from both deaf and hearing educators, providing exposure to both language in their natural forms. So, This is the American Sign Language of alphabet and the numbers from 0 to 9. To accommodate students with hearing impairments and deaf. To make classroom more accessible for students with hearing impairments, teachers should face students while speaking, write instruction and key points on the board, use clear and simple language, develop a system of visual signals for classroom management, utilize assistive devices such as audio amplification systems, incorporate captions, videos, and written materials, pair students with hearing peers for peer tutoring, provide printed copies of important notes and lessons. So these strategies ensure that students with hearing impairments can follow along with lessons effectively. So let's go with placement options. Residential schools. Residential schools offer effective placement options for the deaf learners, enhancing communication and language skills while providing specialized instruction and programs tailored to their unique learning styles. So this school specializes in education for deaf students, providing a structured environment where they can communicate freely in sign language while receiving tailored instructions. They focus on language development, academic achievement, and socialization within the deaf community. Next is inclusive classroom. Deaf children benefit from socializing and exposure to hearing individuals in regular classes, but schools must hire an interpreter for better understanding. Some deaf students attend regular schools with hearing students, which allows them to engage with the broader society. However, for inclusion to be successful, schools must provide support such as sign language interpreters, note takers, and assistive listening devices to ensure that students can fully access the curriculum. Each of these approaches and placement options serves different needs, and the best choice depends on the student's individual learning style, level of hearing loss, and communication preferences. That's all. Thank you.